All right, now let's put our hands together for our webinar's MC, Darren Lau.
Thank you, AV team. Good evening, everyone. First of all, I would like to thank EVG Network and my upline. I'm Darren, your MC for this evening webinar. I would also like to thank all of you for taking your time to join us this evening. So before we begin, our AV team has muted all your Zoom apps to allow the session to run smoothly without interruptions. You can still continue to use the chat function within the Zoom app throughout the whole webinar. We will have a Q&A session towards the end of the webinar. You can unmute to ask your question then, or simply just type your question in the chat box. So presentation slides and pictures will be displayed during the sharing. If you can't see clearly, you may just zoom in for a clearer view. Now, I'm sure many of you are dreadful of the evolving COVID-19 virus, which has caused more than 6 million deaths globally in the 2 years plus period. However, there is actually one silent killer disease that kills way more people, about 17 million people on yearly basis. Isn't that shocking? 17 million deaths per year compared to 6 million deaths for the past 2 years of pandemic. The silent killer is the cardiovascular disease, or more commonly known as heart diseases. So tonight, our speaker Jia Hui will be sharing the cause of this dreadful disease and how we can prevent it from happening to our loved one or to ourselves. Let us all welcome our speaker Jia Hui.
Good evening, everyone. First of all, I would like to thank EV Global Network and my upline, Jia Hui. So today I'll be sharing on how to prevent cardiovascular disease. So in today's society, medical science is so advanced, but many people die from diseases such as cancer, diabetes, and heart disease, right? And according to the statistics by the World Health Organization, also known as WHO, cardiovascular disease is the leading cause of death worldwide. So an estimated 80 million deaths yearly due to cardiovascular disease every year. So it's projected that there will be more than 23 million people dying from cardiovascular disease each year by 2030, meaning in every 3 people, there will be 1 dying from cardiovascular disease. So to keep the deadly cardiovascular disease at bay, we should actively keep the cardiovascular system healthy. So let's understand what is cardiovascular system disease. So cardiovascular disease includes heart disease, stroke, heart failure, and arrhythmia, also known as irregular heartbeat. So let's look at the causes of cardiovascular disease. So it includes atherosclerosis, hypertension, high cholesterol, and high amounts of omega-6. So this means a high amount of omega-6 means that it will cause inflammation in our blood vessels, which leads to atherosclerosis, increasing the risk of heart disease and stroke. So you can tell over here that, with just one cause, right, it's very interrelated. It can cause one and another to follow. So let's first look at how atherosclerosis is formed. So atherosclerosis is a disease whereby plaque builds up inside the arteries. So plaque is made up of cholesterol, fat, calcium, and other substances in the blood. Hence, unhealthy blood cholesterol levels are a major risk factor for atherosclerosis. When bad cholesterol, also known as LDL, accumulates in the artery wall, T cells are activated and attack the bad cholesterol, thereby causing inflammation that leads to atherosclerosis. And to eradicate this problem, we should eat a balanced diet, control cholesterol intake to stop inflammation in our body. So another common disease is hypertension. So I'm sure this is not strange, as a stranger to many of you. So blood pressure is the force of blood pushing against the walls of arteries as the heart pumps out blood. So when does hypertension happen? It happens when there's constant excessive blood pressure on artery walls. So imagine our heart pumping very hard, for our blood to go through our blood vessels. So once blood pressure reading is higher than 140/90, this is known as high blood pressure. So you can take a look at the photo on the right. So the bottom number is known as the diastolic pressure, which is the 90, and the top number is also known as the systolic pressure, which is the 140. So what is a healthy blood pressure range? So the normal blood pressure range is 120/80, but the diastolic pressure is less than 80, and the systolic pressure, the number on the top, is less than 120. So hypertension causes T cells to accumulate in the kidneys, causing kidney dysfunction, leading to the weakening or loss of kidney ability to excrete water and sodium. Hence, hypertension is often known as the silent killer. So when one is hypertension, the doctor will prescribe some antihypertensive medications, right? So have you ever thought of how these antihypertensive medications help to lower our blood pressure? So let's take a look. So there's actually a few of them. The first one is to help to reduce our blood volume. So some antihypertensive drugs can decrease the amount of blood that the heart pumps each minute. So we can, see this as a water pipe. So we have to turn down the faucet to have the water flow smaller, right? And relating that back to our blood vessels, it means that the drug only helps to lower our blood pressure. But the rubbish, the waste, still remains in our blood vessels. And hence, the drug does not solve the root cause. And another type of antihypertensive medication helps to promote urination, which is diuretics. So diuretics inhibit the renal tubular reabsorption of water and sodium to increase the excretion of water and sodium. So this leads to the dilation of blood vessels and lowering our blood pressure. So the third type of antihypertensive medication dilate our arteries by relaxing vascular smooth muscle in arteries and veins. So this temporarily controls hypertension and reduces its symptoms. So have you ever heard that taking antihypertensive drugs can help to solve hypertension? So you can put your answer in our comments as well. So I'm sure that is a no, right? So doctors will advise patients to consume these medications for a lifetime. And why is that so? Because if you stop taking, right, the blood pressure will spike up. As these drugs can only alleviate symptoms, but it cannot solve the root cause. So let's take a look at the side effects of these drugs. So when we're taking these drugs, we have to be extra careful and follow the doctor's instructions on how to take these medications. So these are some of the common medications. First one is the lisinopril, which helps to prevent blood vessel contraction, but at the same time, it can cause persistent coughing, kidney problems, dizziness, and rashes. And the second one is digoxin. So this increases the forces of heart contractions, which slows irregular heartbeats, but it instead causes irregular heartbeats, which is the side effect. So this actually causes loss of appetite, nausea, impaired kidney function. So another medicine is warfarin sodium. This is a blood thinner. So this will cause nosebleed, gum bleeding, easy bruising. So the last one is spironolactone. This is a diuretic like I mentioned earlier. So the side effects of this is poor kidney function and low blood pressure. So these medications can only control the symptoms. So it cannot help to improve the flexibility of our blood vessels, walls. Hence, we must take note that drugs can only alleviate symptoms, but it cannot treat the root cause. If we want to improve our cardiovascular health, we have to understand that the causes of cardiovascular disease. In fact, many diseases are due to what we eat. So what do many of us like to eat? So many of us prefer to eat meat, seafood in our daily diet, right? So according to the American Heart Association, the recommended daily cholesterol intake should not exceed 300 milligrams. So let's take a look at some of the cholesterol in foods so we can choose our foods wisely. So the first one is meat and animal innards. So I'm not sure how many of you here, love to eat this. So let's take a look at the cholesterol. In pig's brain, there's 2,500 over cholesterol, and this itself is exceeding what we need in a day. And cow's brain is over 2,000 as well. Pig's kidney, cow's kidney is about 300 to 400 AP, which is definitely not low as well. And for pig's liver, 368. And for sausage, while it may look quite kind of small, but the cholesterol is pretty a lot as well. So let's take a look at seafood. So cod fish, we have 40 milligrams, prawn, 170 milligrams. Definitely, we can't underestimate this, looking at the size, the cholesterol is a lot. So we have lobster and salmon, which is about 85, 86 milligrams, crab, 100 milligrams, and cuttlefish, 248 milligrams. So some might say, they don't eat meat or seafood, but they like to eat eggs and dairy products. So eggs and dairy products lovers, have to pay attention here, yeah? So let's take a look at the cholesterol in dairy products first. So an egg yolk consists of 266 milligrams, and a dark egg yolk consists of 600 over milligrams, almost 620. And a quail egg yolk is about 74 milligrams. So I'm sure we won't limit ourselves to just one, right? So usually, we eat about 4 or 5 at once. So this will definitely exceed the recommended amount as well. So you can do some calculations as well. So how about scrambled egg? 101 milligrams of scrambled egg consists of 435 milligrams of cholesterol, and 100 grams of cream consists of 140 milligrams of cholesterol. And not to say in cheese, it definitely consists of cholesterol as well. And even ice cream, it has cholesterol too. So it consists about 45 milligrams. And for milk, even though we see a lot of advertisement on milk, but we shouldn't underestimate it as well, because it also contains cholesterol. Let's take a look at the cholesterol in oils. So 100 grams of chicken lard contains 74 milligrams of cholesterol. So not sure, have you ever tried pork lard rice, or using lard to stir fry or barbecue? So isn't it very fragrant? But we need to take note. Lard consists of 56 mg of cholesterol, and 100 grams of butter consists of 260 milligrams of cholesterol. So you can see over here, vegetable oil has 0 milligrams. So that's kind of surprising, right? So although vegetable oil does not have cholesterol, is it really good? In fact, it's actually a major cause of cardiovascular disease. So let's take a look at fast food. So do you like to eat Western food like hamburger and fries? So a small burger like 30 consists of 30 mg of cholesterol. A large double cheeseburger has 80 milligrams, and a fish fillet burger, which I just ate earlier, has 40 milligrams of cholesterol. And a small cup of strawberry milkshake contains 25 mg of cholesterol. So from here, we actually can see that, from our diet, it can actually very easily exceed the cholesterol intake daily if you do not pay attention to our diet. Hence, we should choose more healthy and low cholesterol foods, which can reduce the risk of cardiovascular disease. So I'm not sure if you have a question here right now, does vegans have high cholesterol? Even though, vegans avoid dairy products and eggs, why do they still have high cholesterol? Shouldn't they have no cholesterol at all? So where does this cholesterol come from? In fact, 25% of cholesterol comes from the food we eat, and the 75% of the cholesterol is actually produced by our liver. And that is why, despite being a vegan, right, the cholesterol levels can still be high. And why does our liver produce cholesterol? So let's learn more about liver. So like I said earlier, liver produces 75% of our cholesterol in our body. And why is our liver the most important organ? In fact, our liver is the largest gland in our body. So it has over 500 different functions. So the main functions of liver is firstly, detox and filter our cleanse our blood. So if our liver malfunctions, it can lead to dull skin. Spots start to show up on our skin. So you can also, take a look at this factors as well. This liver malfunctioning, you can take note of your body as well. So secondly, producing bowel. So some people may suffer from indigestion. So this can be related to the malfunctioning of our liver as well. So thirdly, burning fat. So I'm sure this is a topic that many of us like to listen to, right? So in fact, our liver is our major fat burning organ. So if you wish to have a better slimming, weight loss result, we need to make sure that our liver is healthy. And next, regulating our blood sugar level. So if our quality of sleep is not ideal, it can also affect our liver, which in turn results in unstable blood sugar level. So next one will be release of energy. So not sure if you feel you feel tired regularly, even though you're having 6 to 8 hours of sleep. This is because our liver stores carbohydrates for energy. And hence, when our liver is damaged, it is not able to store carbohydrates. And that's why we must take extra care of those with such symptoms. And next is synthesizing of hormones. So when our liver is malfunctioning, it cannot produce the needed hormones for the body to function. So for example, androgen and estrogen, which will lead to endocrine disorders, especially in the modern society right now. So many of us, are prone to being more tense and stressed, because of work, because of studies, and many hormonal imbalances is actually also linked to our liver health as well. And the last one, making cholesterol. So from here, we can see that many health problems are related to our liver. But why does our liver need to make cholesterol? So, I used to think that cholesterol is a bad thing because high cholesterol is one of the causes of cardiovascular disease, right? And high cholesterol requires long-term medication. So, I wouldn't think of cholesterol as a good thing. But in actual fact, we need cholesterol. Without it, we can't live. So earlier on, I mentioned that our liver produces 75% of the cholesterol. So in fact, cholesterol is one of the most essential substances that the body needs to form cell membranes. So we can take a look at the picture on the right. So the smallest unit of a cell is our DNA. So each cell in the body contains cell membranes. So our cholesterol plays a very important role in forming cell membranes. So in addition, cholesterol is also vital for the synthesis of hormones in the body. So for example, the body secretes androgens and estrogens. It needs to have sufficient cholesterol. If our liver is not healthy, it may cause endocrine system to be unbalanced. So have you heard that sunlight has vitamin D? In fact, there is no vitamin D from sunlight. Our body synthesizes the sunlight that we are exposed to, and we turn the cholesterol in our body into vitamin. So therefore, cholesterol is an important element in the synthesis of vitamin D. However, we must also take note that when our liver produces too much cholesterol, the body's total cholesterol will be too high, which will increase the risk of heart disease and stroke. So, every time we go for medical checkup, right, the blood test, report contains a cholesterol report as well. So one of it is LDL, commonly known as the bad cholesterol. And the other one is known as the HDL, commonly known as the good cholesterol. So in fact, Dr. Zhao Fei Chen once said, our body does not have the so-called two types of cholesterol, the good cholesterol and the bad cholesterol. So when our liver produces cholesterol, it will transport the cholesterol to the cells in need of the body. So this is called the low density lipoprotein cholesterol, LDL. So it's like a seller calling out for those who need cholesterol. That is when the cell membranes and the hormones will take in this cholesterol. So when there's excess LDL, it will directly deposit into our blood vessels, forming the plaque. So if it accumulates over time, it will cause atherosclerosis, causing severe blood vessel blockage, leading to stroke and heart attack. So that's why the higher the LDL, the worse it is for our body, which is why we call it the bad cholesterol. So if our liver is healthy, our body will produce enough high-density lipoprotein, which is known as the good cholesterol, HDL. So its function is to collect the LDL in the blood back to the liver where it's broken down. So it removes the cholesterol from the artery walls, preventing atherosclerosis and reducing the risk of heart disease. So the higher the HDL, the better it is for our body, which is why we call it the good cholesterol. So we mentioned earlier that our diet should not only affect our cholesterol, but it will also affect our liver. Because when our liver is unhealthy, it will produce too much cholesterol. And if you have noticed from the earlier sharing, right, in fact, our health of our liver is directly affecting the functioning of our heart. When the liver is unhealthy, it will produce too much cholesterol, resulting in atherosclerosis. And this in turn affects the heart function. Moreover, liver does not have any nerve endings. And what does this mean? This means that our liver cannot sense any pain. So that's why we must take very good care of our liver. And earlier on, I also mentioned that vegetable oil does not contain any cholesterol. And in fact, vegetable oil has adverse impact on our health. So why do I talk about oil? In fact, fat is a basic nutrient required by our body. That's divided into omega-6 and omega-3. So you can actually comment down in the comments as well, what do you think omega-6 and omega-3 is? In fact, the Vegetarian Society of the United Kingdom Limited recommends an omega-6 to omega-3 ratio of 3:1 in one's diet. So high amounts of omega-3 can help to reduce the risk of cardiovascular disease, whereas high amounts of omega-6 causes inflammation in the body and increase the risk of cardiovascular disease and stroke. However, you see, modern diets contain too much omega-6 and too little omega-3. So the typical American diet tends to contain 14 to 25 times more omega-6 than omega-3. So do you usually, cook your meals, or do you prefer to take it out or take away? If it's the latter, it is difficult to control the choice of oil being used, because nowadays people like to eat fried food, right? Because it's convenient as well and tasty. Hence, the ideal ratio of omega-6 to omega-3 fatty acids in our daily diet should be 1:1 and 4:1. So let's take a look at the types of the oil we use at home. So does anyone here uses grapeseed oil? So I'm sure many of us have heard of grapeseed oil, containing OPC, right? Which is very rich in antioxidants. But when it comes to grapeseed oil, it is no longer good for our body. The ratio of omega-6 to omega-3 is so high, it's 676:1. This is extremely high. And for cottonseed oil is 259:1, which is considered very high as well. As for sesame oil, is an essential during confinement. So after confinement, the whole body will be aching because the omega-6 content is very high, causing inflammation. So you can see over here, the sesame oil of the ratio is 137:1, corn oil is 46:1, and palm oil is 46:1. So is it common for us, for people to use sunflower oil during cooking? In fact, the ratio of omega-6 to omega-3 for sunflower oil is 29:1. So let's take a look at the next one. So we have peanut oil over here, which is the ratio is 32:0, pea seed oil 32:1, olive oil, so I'm sure many of us have heard of this as well, right? So the ratio is actually 13:1. It is also quite high as well. So for soybean oil is 7:1, canola oil, also known as rapeseed oil, this is 2:1, macadamia oil 1:1, perilla seed oil 1:4, and kiwi seed oil 1:4. So now that we know that the oil we eat every day increases the risk of cardiovascular disease, so it's no wonder that cardiovascular disease is the #1 killer, because it affects us on our daily basis as well. The things that we eat, the oil that we use. In addition to the causes of cardiovascular disease that I mentioned earlier, for example, atherosclerosis, hypertension, high cholesterol, excessive omega-6 fatty acids. So what other factors can cause cardiovascular disease? We can make a guess as well. So the factors include malfunctioning of our immune system, aging, so when the blood vessels loses flexibility and elasticity, and unhealthy lifestyle, alcohol drinking, smoking, angry, stress, staying up late, as well as unhealthy dietary habits. For myself, it's also very hard for us, to eat out while consuming a lot of vegetables. So a lack of vegetables and fruits in the long run can actually is also one of the causes of obesity. Such unhealthy dietary habits can actually lead to cardiovascular disease as well. So besides just adjusting our lifestyle, what nutrients can we take to prevent the cardiovascular disease, the world's #1 killer? So let me share some superfoods that can help to boost our immune system. So first of all, we have blueberries. So blueberries has a high antioxidant activity, so you can reduce the buildup of LDL, preventing the formation of blood clots, lessening the burden on our liver, lowering our blood pressure, and hence preventing cardiovascular disease and stroke. And next, we have hawthorn. This helps to keep our cholesterol in check, protecting against atherosclerosis, maintaining smooth blood flow by dilating blood vessels, regulating our blood pressure, improving heart functions, and preventing the lack of oxygen in our heart tissues. And next, we have Oriental-18 tree, which is also one of my favorites. So this helps to nourish our liver cells to regenerate, strengthen our liver detoxification function, and also lower our blood pressure and blood lipids, maintaining our cardiovascular health. So like I mentioned earlier, when our liver is healthy, our heart will naturally be healthy as well. And next, we have American ginseng. So this prevents LDL oxidation, preventing atherosclerosis, and promotes liver regeneration and inhibit the growth of cancer cells. So next, we have cactus, the king of plant foods. So this has excellent nutritional value. So it contains 10,000 types of phytochemicals. So it has anti-inflammatory properties. So it aids in wound healing. So like I mentioned earlier, it can help with the inflammation of our blood vessels. So it helps to prevent atherosclerosis and accelerate tissue regeneration. So it can help to lower cholesterol and triglycerides, reducing LDL in the body and promoting cardiovascular health. And next, we have rose, also one of my favorites. So this helps to fight free radicals, delay aging, so enhance collagen production and improve the elasticity and preventing the rupturing of our blood vessels. So this helps to promote blood circulation. And next, we have cordyceps mycelium. So this helps to prevent atherosclerosis, stroke, heart disease. At the same time, it strengthens our heart, our lung, and our kidney functions. So this helps to raise our HDL and lower our LDL. So a clinical research in China actually, there's a research that 273 patients took cordyceps mycelium twice daily, and after 8 weeks, the patients enjoyed an average 17% decrease in cholesterol levels. And in a clinical trial by Guangzhou Medical College, 38 elderly patients took cordyceps mycelium daily for 3 months, and 20 out of the 24 patients with supraventricular arrhythmia, a form of irregular heartbeat, they exhibited signs of recovery. So far I've spoken about superfoods to nourish the liver, right? So to avoid the overproduction of cholesterol and to clear the cholesterol in our blood vessels. So you may think, oh, this can reduce the risk of heart disease and stroke. So is it? So in fact, there's one more place to check, and that is our gastrointestinal tract. So what should we do? So earlier on, I mentioned that there's quite a lot of foods that contains cholesterol, right? But it's impossible for us to avoid all of them because everyone still wants a fair share of eggs, meat, right? So what can we do? And in fact, we can actually consume plant foods that is rich in phytosterols. So it can speed up the excretion of cholesterol from our body. So you can take a look at the slide over here. So the one in pink is our intestines, and the yellow one is the cholesterol we consume from food. So after eating, the cholesterol will be in our intestines, that will be absorbed into our blood vessels. So what happens when we consume phytosterols? So phytosterols will compete with cholesterol to be incorporated into the mixed micelles, which is the one in green. So phytosterols have a greater affinity for micelles than cholesterol. So this means, to put it in simple terms, means like phytosterols is like a best friend of micelles. So you cause cholesterol to be excluded from the absorption process. So this means that the cholesterol won't be absorbed and will be excreted from our body. So in this way, phytosterols can speed up excretion from the cholesterol from the body. So in fact, research has shown that consuming 2.2 grams of phytosterols can reduce the cholesterol absorption of 60% in a day. So let's take a look at the plant foods that are rich in phytosterols. So we have soy. So in fact, for soy, 1 gram of soybean contains about 0.843 milligrams of phytosterols, which has the effect of lowering cholesterol. So consuming phytosterols can reduce the cholesterol content in the body by 10% and the LDL content by 15%. So research shown that consuming 1.5 grams to 1.8 grams of phytosterols a day can reduce cholesterol absorption of 30 to 40%, which the intake of 2.2 grams of phytosterols per day can reduce cholesterol absorption by 60%. So from this data, you can realize that it is difficult to rely on phytosterols to prevent the absorption of cholesterol. But why do I need to mention soy? So because when you think of protein, many of us would tend to drink milk, take eggs or meat, right? However, because this food contains fat, cholesterol, and cancer-causing hormones. On the other hand, soy is cholesterol-free, and its protein is 2 times more than meat, 3 times more than egg, and 12 times
Sorry 啊，不小心按到东西。
So sorry for the
So sorry about that. Technical issue.
yeah. So allow me to continue. Yeah.
Yeah, thanks.
So continuing from the part I've mentioned earlier, so in fact, so today there is actually no drug that can raise HDL. So it's recommended to consume soy for protein, and it can prevent the risk of cardiovascular disease. So the other plant food that is rich in phytosterol is dietary fiber. Besides, it can help to lose weight and prevent constipation. So it can also lower cholesterol as well. So there are 2 types of fiber: insoluble fiber and soluble fiber. So insoluble fiber is like a natural cleanser, like a broom. So it can help to excrete the toxins from our intestines, keeping our intestines clean. So soluble fiber protects the intestines with a protective layer. So think of it like a plastic bag. So it wraps around our gut. So it can prevent the absorption of cholesterol, thus reducing the risk of cardiovascular disease. So do you want to make a guess which plant is rich in fiber? In fact, it's psyllium husk. So in 100 grams of psyllium husk, it contains 71 grams of soluble fiber. So preventing our body from absorbing the cholesterol and fats in the diet, thereby helping us to reduce blood cholesterol and lowering the risk of heart disease. So if you want to live a healthy and a long life, we must prevent the world's #1 killer, cardiovascular disease. As long as we can prevent cardiovascular disease, we can live up to at least 100 years old. Then how can we do it? Firstly, practice the way to health and longevity. To have a healthy body, we have to start from an early age. So firstly, we have to have sufficient sleep and rest. That's to say 6 to 8 hours a day. Next, moderate exercise, just walking, 10,000 steps a day is also counter exercise as well. So this can help to strengthen our heart and lung function, preventing coronary heart disease, and increasing the flexibility of our body and joints, enhancing vitality, and also promoting lymphatic circulation. So many benefits to just exercising, right? And thirdly, so this may sound simple, but it's important for us to stay positive and happy as well. Because when we're unhappy and stressed, our body will secrete corticosteroid, which is a toxic hormones, which will suppress our immune system. So smile more. So together we support balanced nutrition by eating more vegetables and meat. So I hope through my sharing, we will work together to stay away from the world's #1 killer, cardiovascular disease. So for friends who are currently taking medications for the cardiovascular conditions, do practice these 4 ways to health and longevity. In the near future, I'm sure that medication can be reduced or even stopped, of course, with the doctor's advice. So I wish everyone good health and good health. So thank you. I'll pass the time back to the MC.
Thank you, Jiahui, for your wonderful sharing. From her sharing, we have learned that we shouldn't rely only on medication and drugs, which have serious side effects to prevent or alleviate symptoms of cardiovascular diseases. Prevention is always better than cure, and we should watch our diet and lifestyle to ensure a healthy liver and immune system to prevent cardiovascular diseases. So do approach your friend who has invited you into this webinar today to find out more information in details. And has anyone benefited from consumer nutritional immunology products? It is definitely a yes. So in the next segment, we have a testimony from a lady who has regained her health consuming nutritional immunology products. Jacqueline has suffered from autoimmune disease since a very young age. In recent years, she suffered a stroke amid her pre-existing medical condition. She made a very amazing recovery within 6 weeks upon discharge from the hospital. So before we invite Jacqueline for the sharing, I would like to seek everyone's cooperation by not taking any photo during the testimonial sharing. Now, let's welcome Jacqueline.
Good evening. Thank you for having me here tonight. My name is Jacqueline. I want to thank my sponsor for introducing nutritional immunology to me. The knowledge and the product definitely serve a very huge positive impact on my life. A little background on myself. I used to be an athlete during my school days. But by the age of 20, I was diagnosed with lupus. During that time, all my career goals, my holiday dreams, and even my marriage was shattered because I started battling the side effects of medications, one of them being steroids, and very frequent hospitalizations. In fact, before my 28th birthday, I was already on dialysis. That was total kidney failure. Said right. Thank God I get to know nutritional immunology that eventually turns my life around. Tonight, I want to share an experience that happened last year. It was during the circuit breaker, May 2nd. It was a Saturday morning. Everything was good and fine like normal. But a sudden giddy spell hit me. And that giddy spell started an episode of a stroke. When the second ambulance brought me to Tan Tock Seng Hospital, it was 5 hours later. And what happened to my body is that already half of my body, the left half of my body, has gone totally out of control. It was very, very scary. Very scary that I cannot feel my body, not even my tongue. So during the hospitalization, so much drugs were pumped into my body that it affected my liver, it affected my pre-existing conditions. And my liver suffers toxicity. I know the doctor said the ALT was very high. To cut the story short, I was discharged after 1 month. That means 30th May, I was discharged upon my persistent request. So when I reached home on wheelchair, because I couldn't sit by myself and I couldn't stand yet. But at least I was positive because I have my products at home. And I can start taking back my usual stuff, which is Rhapsody in the morning, my soy green as my breakfast, and my immunity and berry beet in the afternoon. And throughout the whole day, I can drink my charm moment as a thirst quenching drink. And being worried about my liver index that is high, I remember hearing a testimony that shared about the product raising tree that nourishes the liver. So immediately I put in the order and start taking one additional product, raising tree. I persistently take it every day without fail. And till the day I have to go for my first follow-up after discharge, it was 6 weeks. I remember that was 13 July. And guess what? I woke into the doctor's consulting room independently. And that shocked the professor that was treating me the whole month when I was in Tan Tock Seng Hospital. She said, "You walk in alone?" I say, "Yes." And in fact, I drove there. Amazing, right? She asked how I recover. Frankly, I really don't know. The body recovers at a very speedy rate. I can stand, I can start taking baby steps, and I can start walking. Started by holding on to somebody else, and eventually I can walk in 6 weeks' time. But what amazing I want to share with you tonight is my results. Upon reviewing my blood results, my liver went back to the normal range. And that was the biggest joy I remember in my doctor's room. And not only that, including all my other blood results, it was just a mere 6 weeks of persistent taking my products. Now you can know why I'm such a strong believer of my nutritional immunology products, right? I remember the professor said, "You are so lucky to have almost full recovery." She used the word almost because at that moment, my left arm from here to my fingers, it was still totally numb. Although I can walk, my leg is recovering, but this hand was still numb. I can lift it up, but it was numb. And she said it will not be well fully. Very sad that doctors give negative news, right? But I want to encourage you. Today, this hand is 90% healed. It may get numb, but that's once a while, not the fully numb that was 1 year ago. So, do you think this is really unlucky? Well, if you think so, the luck, to me, I believe, is the decision that I made years ago when I decided to take care of my immune system after hearing the science of nutritional immunology. So I'm so thankful, I'm so grateful. I'm so thankful to Dr. Chan, who founded the science, and I'm so thankful to my creator that helped me throughout the whole healing process. And dear friends, tonight, if you have yet to know nutritional immunology, I urge you, please explore. It is a true science that's going to bring true health. Do not miss it. Do not learn the importance of our immune system only after something happened. It is a very high price to pay. I do live a normal life now. I enjoy my life, just like anybody else. But I still have to go for my dialysis. So please, I hope my sharing can inspire you to really look into start taking care of your life. Thank you for hearing my sharing. Good night.
Congratulations to Jacqueline. This is really inspirational. Inspirational. So from being wheelchair bound after getting a stroke to driving to medical appointment all by herself after 6 weeks at home. In addition to providing her immune system with necessary nutrients, I'm sure the positive attitude she has shown just now, she has towards her life, is one of the very contributing factors for regaining her health. So we have a disclaimer here. I would like to highlight that elite products are plant-based food, which are very beneficial for health maintenance. However, elite does not advocate any form of self-diagnosis or medical treatment. If you have any medical condition, please seek professional medical help. Now we have the Q&A segment. I believe that through the sharing just now, you may have a question to ask. You can unmute yourself to ask a question or type in the question in the chat box. So we'll try our best to answer all your questions, but please limit to one question per person. So let me check the chat box right now. All right, see a question. It's from email, iPhone. So the question is, my friend says that he prefer to eat fresh fruits and vegetables and does not want to eat food that are processed. How should we analyze elite products to ensure him of its safety and nutritional values? Yeah. So thank you for your question. It's a very good question. Is there anyone from the Q&A committee who would like to answer this?
Darren, this is Joy. I think I
Thank you,
can
Joy.
help to answer this question.
Okay, thank you, Joy.
Okay, good evening, everyone. My name is Joy. I'd like to thank EVG and my upline for introducing this elite career to me. Actually, in fact, this is a very good question, as personally for myself, I used to have the same thinking as well when it comes to consuming packaged food. But after understanding in more details how elite products can is manufactured, and I now understand that it actually packs more nutrients that I can find in my regular meal. So now let me start to share with all of you. Okay. Okay. There are actually many health food in the market today. So it is no doubt that many people will be actually worried about the chemical processing, and the extraction of vitamins and proteins. As consuming food that are processed using these methods are really not ideal for the body in the long run. Yeah, for example, vitamin pills or whey protein powder. And in fact, some manufacturers actually, they also add hormones, stimulants, caffeine, and other ingredients to their products. Some even add drugs to make their products more effective. There are also, that was also my concern as well, and that's why we do not recommend these products due to the possible long-term side effects. Okay, so we certainly encourage consuming fresh fruits and vegetables such as blueberries, raspberry, and cranberries, like what Jia Hui has introduced earlier. But how can we ensure that the food have the highest nutritional values? In fact, common fruits such as bananas contains the highest nutritional value when they ripen on the trees and are eaten immediately after harvesting. But in our modern society today, how are we able to access bananas at this stage? Unless, of course, if you can plant a banana tree at home. Okay, so let's analyze some of the challenges that we face when we consume food. Due to the logistical delays in modern world, even like recently, I think a lot of us will have faced logistical delays as well. From the farms to the supermarkets, fresh foods actually reach us days, weeks, or even months after they are harvested. So these food are no longer fresh when we can access them. And needless to say, their nutrients are also will be depleted through the delivery process. Do we consume the fresh food directly after buying from the supermarket and after the food reach home? Actually, most of the time, the food will be kept in the refrigerator for a few days before consumption. So as the water is the main cause of deterioration, and the fresh food contains water, this naturally accelerates the rotting process, encourage bacterial growth, and also toxin production. Okay, which is why fresh food are highly perishable products. And finally, what are the preparation methods we use to cook those vegetables? Are they stewed, steamed, fried, stir-fried? Dr. Chen actually shared that vegetables and fruits are best eaten raw when their nutritional values are the highest, because the process of high temperature cooking actually destroys many of the phytochemicals and antioxidants in plant food. Then you may ask, how does Elite's nutritional immunology food preserve the plant nutrients? Let's take a closer look at the manufacturing process of Elite products. Elite products are manufactured under strict and advanced processing processes to retain the highest nutrients of the plants. The products come in two forms, powder and liquid. Most of Elite's powdered products are manufactured using the freeze drying process. Some of us may have heard of IVF fertility procedure. This procedure involves the process of rapidly freezing a man's sperm for later use, and it has proven that the cells of the frozen sperms are still alive. Similarly, in the freeze drying process, food is rapidly frozen to -50 to -80 degrees within a few seconds. Okay, and it then moves on to the sublimation process in a vacuum. Okay, and it can take either 3 to 4 days for a whole strawberry or 14 to 16 hours for sliced strawberries and other fruits. Therefore, this is actually a very time-consuming process, but it retains most of the nutrients in the fruit, the original flavor, the shape, color, and the texture. Okay, so for example, if we freeze a strawberry, right, 1 kg of fresh strawberries after freeze drying, removing all the liquid components in the fruit, we will get about 80 grams of freeze-dried strawberries. So this is the quantity of strawberries that we will get in the freeze-dried portion. Okay. The other processing method is spray drying method. This is the process that soy actually goes through. Okay, soy needs to be heated to 60 degrees for 30 minutes. Soy needs to be heated because it has to remove some of its microtoxicity and microorganisms that is in the soy, and yet retain its highest nutrients. So what is the difference between the soy products made by this spray drying method and the soy milk that we generally drink in the market? The main components of the soy milk is actually filtered water after it has been cooked. However, most of soy's nutrients are in the soybean itself and not in the soy milk or the liquid that is cooked in. As the soy milk we drink is usually boiled, the nutrients would have been destroyed at such a high temperature. But looking back at this spray drying process, during the process, the heated soybeans are constantly sprayed into a tall drying chamber that you can similar to this diagram here or this picture here, 2 to 3 stories high, and they are blended and dried continuously, transforming the food substance from liquid to powder form. And this is a similar process that is used in milk powder production as well. Okay, and next, when it comes to Elite's liquid products, they are processed by a method called high purity filtration. For example, cactus gel needs to be quickly filtered to remove impurities and other particles. It goes through centrifugation and filtration, then microfiltration. Okay, the second step here, and then ultrafiltration. This is up to 0.1 microns. And what this means is that this process will remove smaller microparticles like bacteria as well. Okay, the above are all the strict and advanced technologies used to preserve the nutritional value of the precious ingredients such as cactus fruit, rose, cordyceps mycelium, and other ingredients in Elite products. Besides the ingredients, in a country like Singapore, where food safety is extremely important and strict, Elite's manufacturing plant has not only obtained GMP certification voluntarily, okay, the company has also been awarded the Gold Award for the Food Safety Excellence by Singapore Food Agency, SFA. The Gold Award was won because all the products from the ingredients farming, harvesting, and processing, all the way to the production line and packaging, not only follow the strict and advanced processing technologies, but also undergo more than 2,000 safety tests. You may think that, this number sounds like an exaggeration. Actually, it's not so, because the tests cover about 400 types of pesticides and heavy metal, as well as more than 1,000 types of toxin testing to ensure that the products do not contain all these harmful elements. Okay. And next, let's look at the product's packaging. If we take a look at the liquid products in the market today, we'll find that most liquid products, example like a milk, they are packed in paper carton packaging. And most of the time, these require preservatives to extend a product's freshness. For elite product, only the patented Japan Topan packaging is used, allowing for the liquid products to have a shelf life of 18 months. Compared to conventional paper cartons, Topan's packaging uses special paper carton made from EP-PAC GL film. Okay, this patented state-of-the-art technology uses not just one, it has 5 protective barriers to ensure that the product freshness is fresh and of high quality. Okay, comparing this to a conventional paper packaging that we can see in milk packaging, milk packaging are typically made from the paper board coated with only one layer of the waterproof plastic. Okay, and actually tiny impurities may enter the product and contaminate the product in the packaging. Due to the fact that conventional packaging is not fully sealed, okay, it may also leak, the product may also leak out and therefore have a shorter shelf life. Okay, compared to this, right, EP-PAC packaging, they do not leak so easily as it can be used for high sodium or high acidic liquid, as it has this superior multi-layer coating, this 5-layer coating. And at the same time, it can also fully seal up the packaging with the patented edge protect structure. This means that our products in elite products actually will have a longer shelf life. Okay. Next, we look at the packaging for another product, our tea product, Cha Moment. Cha Moment tea is packaged in high quality PET, okay, from Japan that can withstand temperatures exceeding 250 degrees and will not leak plasticizer. On top of this, the tea bag is sealed using ultrasonic sealing technology, and the string is attached using laser heat. The tag is printed using food-grade ink imported from Japan. And finally, the design of the pyramid tea bag allows us to enjoy a better infusion and flavor from the tea. And all these safety considerations, all for the sake of a safe product for our consumers. Okay, so with my sharing, I hope you can now understand that the elite products actually is able to maintain the wholesomeness of all the ingredients in our products. They can retain their original taste, color, and nutrients like phytochemicals, antioxidant, polysaccharides, and fiber without the need to add preservatives into the powdered and liquid products. With the meticulous packaging, it can also ensure that products remain of high quality and they are always safe for consumers. This is why elite products will be fresher than fresh produce from the market. I hope my sharing helps to answer this question. Thank you.
Thank you, Joy, for answering this question. Wow, 2,000 safety tests. That is not something that will be applied to common, off-the-shelf supplements and food products, isn't it? Also, with this information, I'm sure that we are all assured not only on the safety, but also the nutritional wholesome value of the elite products. And I see earlier on that someone has mentioned that that is the value of elite product. It's very true. Yeah. So let's see if there's any more question. Looks like there's no more question. So we shall end the Q&A session right here. Next,